slip-resistant flooring. Tiled or polished wood floors become dangerous when wet. According to the World Health Organization, WHO, installing non-slip mats and treads on stairs and bathrooms decreased falls in high-risk seniors by 37% over 12 months. Tip: use textured rubber mats in the shower, adhesive strips on steps, and rubber-backed carpets if rugs are necessary. Assistive devices aren't a weakness, they're smart. Walkers, canes, and even raised toilet seats can help older adults maintain independence. A 2022 study from the Journal of Geriatric Physical Therapy found that seniors who adopted early use of assistive tools experienced 30% fewer fall-related ER visits over a one-year period. Now, here's the hard truth. Most families wait until after a loved one falls to make these changes, but by then, it's too late. I always tell my patients and their children, if you wait for a fall to act, you're reacting to an injury. If you prepare now, you're preventing one. Solution number 5, knowing when to seek professional help. Falling once after the age of 65 isn't just a warning sign, it can triple your risk of falling again. But with the right support, that risk can drop by nearly half. Here's something I wish more seniors and their families understood. You don't have to fall to need help. Even if you've only felt off balance or walked slower than usual, your body is already giving you signals. Ignoring them doesn't make you strong, it makes you vulnerable. According to the Centers for Disease Control and Prevention, CDC, over 36 million falls are reported among older adults in the US each year. That's one fall every second. And for those over 65, just one fall increases your risk of falling again by 200%, 300%. Now here's the good news. Seeking professional help early can significantly reverse that trend. A 2021 systematic review in the Cochrane Library found that seniors who received personalized physical therapy after a fall saw a 43% reduction in repeat falls. Another study published in the Journal of Geriatric Physical Therapy showed that starting therapy within 30 days of a fall led to faster recovery, stronger leg function, and lower fear of falling. I had a patient, Tom, age 77. He came in after tripping on a curb outside the grocery store. He wasn't hurt badly, just shaken. But his gait had changed. He was walking slower, constantly looking down and avoiding public places. His daughter convinced him to see a physical therapist. After 8 weeks of balance and core training, Tom said, "I don't just walk better, I feel like myself again." So, when is it time to seek professional help? If you've fallen even once in the past 12 months, if you felt off balance, unsteady, or dizzy, if you've started to avoid stairs, curbs, or uneven ground, if walking feels harder than it used to, or you're hesitating more often, if you're afraid of falling and have cut back your activity because of it, these aren't signs of weakness. These are signs that your body needs support, and the sooner, the better. A physical therapist can perform a fall risk assessment, checking your balance, stride, muscle strength, posture, and flexibility. They'll create a personalized movement plan tailored to your needs, usually including gentle strength training, posture correction, and walking drills. And in some cases, they may recommend assistive devices like a cane, walker, or mobility poles. These are not a step backward. In fact, according to the American Physical Therapy Association, APTA, older adults who use assistive tools correctly have 30% fewer falls than those who avoid them out of pride. The World Health Organization, WHO, emphasizes that using appropriate support, both human and equipment, leads to greater mobility, independence, and even improved mental health. Falls are not just physical, they affect confidence, mood, and quality of life. And here's the part no one talks about. Only 1/3 of seniors who fall tell their doctor. That silence can be deadly. Taking control of your balance and safety doesn't require big changes, just consistent ones. From adjusting your posture and breathing, to doing a few simple strength exercises each day, to making your home safer, and knowing when to ask for professional help, every step matters. The truth is, falls don't just happen, they build up over time and they can be prevented. So please don't wait for a fall to make the first move. Start today. Your body will thank you, and your future self will too. If this video helped you or someone you care about, be sure to like it, share it with a friend, and subscribe to Elderly Health Tips for more simple, science-backed ways to stay strong, steady, and independent no matter your age. How to do it right. Here's my prescription, and you don't need a pharmacy for it. 1 glass of warm filtered water, juice from half a fresh lemon, a pinch, just 1/8 teaspoon of Himalayan pink salt. Drink it slowly within 30 minutes of waking up, before coffee, tea, or food. A word of caution. If you have advanced kidney disease, heart failure, or are on a low sodium diet, talk to your doctor first. But for most healthy seniors, this is a gentle, natural habit that supports long-term kidney and overall wellness. Drink number 5, barley water. 1 humble grain, backed by science, proven in patients, and powerful enough to lower creatinine, flush toxins, and calm inflammation without a single pill. Let's take a deeper look at why barley water belongs in your daily routine, especially if you're over 60. High creatinine levels are often a warning sign your kidneys are struggling to filter waste, and in older adults, this can creep up silently. A 2020 study published in Renal Failure followed patients with mild to moderate kidney dysfunction. After drinking barley water daily for 4 weeks, their serum creatinine dropped by an average of 15%, and blood urea nitrogen BUN also improved. Researchers credited the effect to beta-glucan, a powerful soluble fiber in barley. Why is this important? Because even a 10–15% drop in creatinine can delay the need for medication or even dialysis by years. Barley water acts as a natural, gentle diuretic. It helps your body release excess sodium without the electrolyte loss caused by prescription diuretics. A clinical review in the American Journal of Clinical Nutrition, 2017, found that high beta-glucan intake significantly enhanced sodium excretion in older adults, particularly those with mild edema or hypertension. This is critical because many seniors retain water, especially around the ankles, knees, or hands. That puffiness is not just cosmetic, it's a sign your kidneys and circulation are under stress. My patient, Dorothy, age 76, used to need compression socks daily. After 3 weeks of drinking barley water with lemon, her swelling reduced dramatically. She even started walking farther without discomfort. Elevated uric acid is a major driver of gout, joint pain, and kidney strain. Barley contains compounds that help alkalize the body, making it easier to flush uric acid through the urine. A 2019 study from the International Journal of Preventive Medicine observed that regular barley water intake reduced uric acid levels by up to 22% over 30 days. If you or someone you love has stiff fingers, sore toes, or achy knees that flare up at night, uric acid could be the problem. Barley water helps prevent those painful crystals from forming in your joints and kidneys. Chronic inflammation is like a slow-burning fire in the body linked to heart disease, diabetes, arthritis, and even memory loss. Barley is rich in polyphenols and tocotrienols, natural plant-based compounds that fight inflammation at the cellular level. The Journal of Nutrition, 2021, published a meta-analysis showing that beta-glucan from barley reduced levels of C-reactive protein, CRP, a major marker of systemic inflammation, by an average of 23% in older adults. It also improved HDL, good cholesterol, and lowered LDL, bad cholesterol, both of which support heart health, especially in seniors with metabolic syndrome. Older adults often deal with constipation, bloating, or irregular bowel movements. Barley water, rich in soluble and insoluble fiber, feeds good bacteria in the gut and keeps things moving smoothly. In one Harvard Medical School newsletter, gastroenterologists recommended barley as part of a fiber-forward plan to reduce constipation in people over 65, especially those taking medications that slow the bowels. Plus, a healthy gut microbiome has been linked to better brain health, immunity, and even mood stability. How to make it? My simple recipe. Rinse 1/2 cup of whole barley thoroughly. Boil in 4 cups of water for 30-40 minutes. Strain and let cool, drink warm or chilled. Add lemon, ginger, or cinnamon if desired. Drink 1 to 2 cups daily morning and or early afternoon. Note: always use unsweetened barley water. Avoid canned or processed versions with sugar or additives. If you have celiac disease or severe gluten sensitivity, check with your doctor. Barley does contain gluten. Also, if you're on a fluid-restricted diet or advanced stage kidney disease, speak with your nephrologist before increasing fluid intake. Drink number 4 has a name that sounds sweet and gentle, but its benefits are truly powerful: dandelion root tea. Over the years, I've treated thousands of older adults who came in with the same complaints: swollen ankles, fatigue, rising creatinine, and that familiar line in their lab results: slightly decreased kidney function. Now here's the part that surprises most patients. Sometimes the body doesn't need more medication. It needs gentle support, and one of my favorite tools for that is dandelion root tea. Let's break down exactly what it does and why it works. Dandelion root contains terexasterol and inulin, compounds that gently stimulate the kidneys to release excess water, especially when the body is holding on to too much sodium. In a study published in the Journal of Alternative and Complementary Medicine, 2009, participants who drank dandelion extract increased urine output significantly within 5 hours without any electrolyte loss. That's a big deal for seniors, who often suffer from mild edema but can't tolerate strong prescription diuretics. In older adults, I often see fluid pooling in the lower legs, ankles, or fingers, especially in the afternoon. If you're noticing tight shoes or rings that don't fit by evening, your kidneys may be struggling with fluid balance. Dandelion tea can help relieve that gently, without stressing your system. A 2020 animal study in renal failure showed that rats with induced kidney damage who were given dandelion root extract had significantly lower creatinine and blood urea nitrogen (BUN) levels compared to the control group. While more human studies are still in progress, the preliminary data is promising, especially since creatinine and BUN are key markers of kidney strain. In my clinic, I've seen similar trends. One of my long-term patients, Linda from Oregon, age 68, had creeping creatinine levels and mild brain fog. We added dandelion tea once a day, between meals, and within 8 weeks, her lab showed a drop of 0.2 mg DL in creatinine, not dramatic, but steady and meaningful. More importantly, her energy and digestion noticeably improved. One of the most dangerous but silent kidney threats is fibrosis, the slow buildup of scar tissue that prevents proper filtration. Dandelion root is rich in antioxidants like luteolin and chlorogenic acid, which fight oxidative stress, a major driver of fibrosis in aging kidneys. A 2021 review published in Frontiers in Pharmacology confirmed that dandelion extract reduced fibrotic markers and helped preserve kidney tissue structure in preclinical trials. If you're over 65 and have chronic inflammation, metabolic syndrome, or long-term medication use, like NSAIDs or statins, your kidneys are more vulnerable to scarring even if your eGFR still looks normal on paper. Dandelion tea won't reverse damage overnight, but it may slow the process and protect what's still functioning. Here's what many people don't know. The liver and kidneys are a team. If the liver is sluggish, the kidneys often have to compensate. Dandelion root has long been used to support liver detoxification, thanks to its bitter compounds that stimulate bile production. A small 2013 study in the Review of Diabetic Studies showed that dandelion helped improve insulin sensitivity and lipid metabolism in adults with type 2 diabetes, indirectly reducing pressure on both liver and kidney function. If you have fatty liver, insulin resistance, or are on multiple medications, this tea does more than just help your kidneys. It supports the entire detox system. For most older adults, 1 cup of dandelion root tea per day, sipped between meals, is a safe and effective place to start. How to brew it. Use 1 TSP dried dandelion root or a bag. Steep in hot water for 10-15 minutes. Drink it warm, plain, or with lemon. Do not add sugar or milk. This disrupts its medicinal effects. Some patients find it bitter, but that's part of the benefit. Bitters help stimulate digestion, bile flow, and bowel movement, which many older adults struggle with. If you're on diuretics, lithium, or blood pressure meds, talk to your doctor before using this tea. It can enhance the effect of those drugs. If you have gallstones, dandelion may increase bowel movement again. Speak to your physician. Always monitor your hydration and electrolyte levels if you're drinking it daily. Drink number 3, blueberry and parsley infused water. One of the most overlooked yet scientifically backed remedies I've recommended is blueberry and parsley infused water. Let's take a closer look at what it does for the body, especially kidneys, and why I now prescribe it more often than some pills. Blueberries aren't just brain food, they're kidney protectors too. The deep blue pigment comes from anthocyanins, a group of polyphenols known for their anti-inflammatory and antioxidant properties. A large-scale cohort study published in the Clinical Journal of the American Society of Nephrology, CJASN 2020, tracked over 14,000 adults over age 50 for more than a decade. The study found that those who consumed anthocyanin-rich foods, particularly blueberries, had a 36% lower risk of developing end-stage kidney disease, ESKD. Here's why it matters. Chronic low-grade inflammation damages the renal tubules, the tiny filtering channels inside your kidneys. Blueberries help by reducing TNF-alpha and IL-6, both markers of kidney inflammation. A 2019 trial in Nutrients confirmed that older adults who consumed 1 cup of blueberries daily showed reduced markers of oxidative stress and improved vascular function, including better blood flow to the kidneys. Blueberries also lower uric acid and support endothelial health, which protects the delicate blood vessels inside the kidneys. Parsley is rich in apigenin, a flavonoid with nephroprotective effects. It helps counteract nephrotoxicity, that's kidney damage caused by medications, heavy metals, or high blood sugar levels. In a 2022 study published in Molecules, rats given apigenin alongside a kidney toxin showed 65% less renal tissue damage, lower blood urea, nitrogen, BUN, and restored antioxidant enzyme levels like SOD and catalase. These findings, though preclinical, suggest parsley helps the kidneys resist both chemical and oxidative stress. Another study from Phytotherapy Research, 2021, showed parsley extract helped increase urine output, reduce kidney stone formation, and maintain electrolyte balance without depleting potassium or magnesium, which is critical in seniors. When combined in water, blueberries and parsley create a gentle, flavorful tonic that reduces inflammation in the nephrons, the working units of the kidney, improves hydration without overloading sodium or sugar, supports liver detox. Parsley also stimulates bile, enhances antioxidant status, which is crucial for aging organs, improves diuresis, urination, which helps flush toxins and excess uric acid. Unlike juices or supplements, infused water is low in sugar, 0 calorie, and can be sipped steadily throughout the day. That's key for older adults who need steady hydration without overwhelming the kidneys. How to prepare it, doctor's method. 1/4 cup fresh or frozen blueberries, 1 tablespoon chopped parsley, flat leaf preferred, 1 liter, about 4 cups, filtered water. Add all ingredients to a glass pitcher or jar. Let it steep in the fridge for 2 to 4 hours. Sip throughout the day. Refill once using the same ingredients, then discard. Optional. Add lemon slices or cucumber for extra flavor and kidney support. Cautions to keep in mind. Blueberries may interact with blood thinners like warfarin due to vitamin K in parsley. Check with your doctor. Avoid parsley if you have oxalate-based kidney stones, though this is rare. Always monitor kidney labs if you're on diuretics or a restricted fluid plan. Drink number 2. Chlorella water. Let's begin with what chlorella is most famous for: its ability to bind and eliminate heavy metals from the body. This is vital because toxic metals like cadmium, lead, mercury, and arsenic accumulate over time, and the kidneys are their primary storage site. A breakthrough study published in Environmental Toxicology and Pharmacology 2020 found that chlorella supplementation led to a 66% reduction in cadmium accumulation in the kidneys of exposed rats. Blood markers like creatinine and BUN also improved, signaling relieved filtration stress. According to the CDC, over 50% of adults over 60 have detectable levels of cadmium or lead in their system, mostly due to old cookware, industrial jobs, pesticides, or decades of exposure to air pollution. Another 2019 review from Journal of Medicinal Food found that chlorella binds to mercury and lead in the GI tract and blood plasma, reducing their ability to deposit in organs, especially the liver and kidneys. For older adults with long-term medication use, past occupational exposure, or history of smoking, this matters. Your kidneys may be silently struggling with what they've been holding on to for years. Beyond detox, chlorella helps the kidneys heal. It contains a compound called chlorella growth factor, CGF, rich in nucleic acids, peptides, and amino acids that stimulate tissue regeneration. This has been shown to help repair damaged renal tubules and slow the progression of kidney fibrosis, which is the scarring and hardening of kidney tissue over time. A study from Frontiers in Pharmacology, 2018, found that chlorella reduced renal fibrosis markers such as TGF-beta1 and collagen expression, increased nephrin and podocin expression, key proteins in the kidney's filtration barrier, restored normal kidney morphology under microscopy. This is crucial for older adults with early-stage chronic kidney disease, CKD13, diabetes or high blood pressure, long-term NSAID or medication use, or a family history of kidney failure. In one case, I had a patient, Barbara, 74, from New Mexico who had slow progressing CKD with eGFR around 56. After 6 months of using chlorella every morning, 1/2 teaspoon in water, her eGFR stabilized, proteinuria decreased, and her fatigue improved significantly. She didn't change her meds, just her morning routine. Your kidneys are surrounded by a network of fragile capillaries, and when blood pressure is unstable, they suffer. Chlorella may help regulate this through its magnesium content, nitric oxide stimulation, and anti-inflammatory action. In a randomized controlled trial published in Clinical Nutrition eSpin 2021, adults who consumed 1.2 grams of chlorella daily for 12 weeks showed a 7.9 millimeter drop in systolic blood pressure, a 4.2 millimeter drop in diastolic blood pressure, reduced C-reactive protein, CRP, a marker of chronic inflammation. These effects were even stronger in people over 60 with stage 1 hypertension or metabolic syndrome. Inflammation is often the root cause of glomerular damage, which leads to leaky filters, proteinuria, and eventual loss of kidney function. Chlorella helps calm that inflammation at the root. Chlorella also supports liver detox pathways, helping your body eliminate toxins before they ever reach the kidneys. It increases glutathione, the master antioxidant used in both liver and kidney protection. It reduces intestinal permeability, leaky gut, which lowers the amount of bacterial toxins reaching the bloodstream and kidneys. It stimulates immune surveillance, supporting overall recovery in aging adults. A 2022 study from Nutrients found that older adults taking chlorella had improved gut microbiota balance, increased levels of butyrate-producing bacteria, and better bowel regularity, a crucial part of natural detoxification. How to use chlorella safely and effectively. My protocol. Every morning before coffee, food, or medication, mix 1/2 teaspoon of chlorella powder into 4-6 ounces of water, room temp. Stir or shake vigorously, it clumps easily. Drink, slowly follow with a full glass of filtered water. Wait 15-20 minutes before consuming anything else. Start slow, 1/4 teaspoon for 5 days if you're new. You may experience mild detox symptoms, for example, loose stools, mild nausea, or headache, which usually resolve in a week. Always choose cracked cell wall chlorella, as it increases absorption up to 80%. Drink number 1, hibiscus tea. Let's begin where the science shines brightest: kidney protection. A study published in Renal Injury Prevention, 2019, showed that hibiscus extract significantly reduced kidney injury biomarkers by 47% in rats with nephrotoxicity. This included major reductions in serum, creatinine, blood, urea, nitrogen, BUN, and urinary protein excretion, key indicators of renal stress and declining glomerular function. The researchers noted that hibiscus helped preserve renal architecture, reduce oxidative stress in renal tissue, and stabilize glomerular filtration units, GFR. This was attributed to hibiscus's high content of anthocyanins, flavonoids, and hibiscus acid, which have potent antioxidant and anti-inflammatory effects. For elderly adults, especially those with early-stage chronic kidney disease, CKD, this tea is not just safe, it's protective. One of the most robust areas of hibiscus tea research is its impact on hypertension, a leading cause of kidney damage and cardiovascular disease in older adults. A double-blind, placebo-controlled trial published in the Journal of Nutrition, 2010, studied 65 adults with prehypertension and stage 1 hypertension. Participants who drank 3 cups of hibiscus tea daily for 6 weeks experienced a 7.2 mmHg drop in systolic blood pressure, a 3.1 mmHg drop in diastolic pressure, statistically significant improvements in overall cardiovascular risk markers. Notably, the reduction was even greater in adults over 60, especially those who were salt sensitive. A 2015 meta-analysis in phytomedicine covering 5 clinical trials and 390 participants confirmed that hibiscus tea was as effective as captopril, a common ACE inhibitor, for reducing blood pressure with fewer side effects. This matters because hypertension is a silent killer, and many seniors are either under-medicated or over-medicated and still not achieving control. Hibiscus tea also acts as a natural diuretic, increasing urinary output without disrupting potassium or sodium levels, unlike many prescription water pills. In a randomized crossover study published in Phytotherapia, 2012, hibiscus increased 24-hour urine volume and improved urinary sodium excretion in mildly hypertensive adults. The study noted that electrolyte balance remained stable, making hibiscus a safer long-term option for older adults. This is ideal for patients who experience swollen ankles, puffy hands, or morning facial swelling, have been on NSAIDs, steroids, or other meds that cause water retention, are at risk of diuretic-induced hypokalemia, low potassium. I've recommended hibiscus tea to many seniors who were afraid of taking diuretics. In several cases, they reported reduced swelling, less shortness of breath, and better sleep just from drinking 1-2 cups daily after meals. In aging kidneys, fibrosis, scarring, is a major threat. It reduces the number of functioning nephrons, the very units that filter blood. A 2020 study in biomedicine and pharmacotherapy found that hibiscus extract reduced renal fibrosis progression in diabetic rats by inhibiting TGF-beta1, signaling a key pathway in fibrosis development. Additionally, hibiscus improved fasting, blood glucose, and reduced HbA1c levels, suggesting a broader metabolic benefit important for diabetic seniors who often struggle with both blood sugar and kidney decline. In humans, studies have shown that hibiscus may modestly reduce post-meal blood glucose and improve insulin sensitivity, helping reduce renal hyperfiltration caused by poor glycemic control. Aging kidneys are exposed to ongoing oxidative stress, inflammation, and free radical buildup. Hibiscus tea contains a wide spectrum of polyphenols, vitamin C, and anthocyanins, all of which help scavenge free radicals, reduce chronic inflammation, measured via CRP and IL-6, protect blood vessels inside the glomeruli from damage. In a 2021 study published in Oxidative Medicine and Cellular Longevity, hibiscus extract reduced inflammatory cytokines in patients with metabolic syndrome and improved overall vascular function, all without affecting liver enzymes or causing GI side effects. How to use it, doctor's recommendation. Dosage: 1 to 2 cups per day, ideally after meals. Use 1 teaspoon of dried hibiscus flowers per cup of hot water. Steep for 10-15 minutes. Strain and enjoy warm or cold. Optional, add lemon or a dash of cinnamon for taste and synergy. Do not add sugar. It blunts the anti-inflammatory benefits. Brew in batches and refrigerate for up to 72 hours. So there you have it, 6 simple drinks backed by real science and trusted by doctors. From lemon water with Himalayan salt to barley water, dandelion root tea, blueberry parsley infusions, chlorella water, and hibiscus tea. Each one offers your kidneys a little more protection, a little more healing, and a lot more hope. But knowing isn't enough. Because the truth is, your kidneys can't wait. They've carried you for decades through stress, medications, toxins, and time itself. Now is your turn to support them. Start with just one drink. Make it a habit. Listen to your body. And if this video helped you or reminded you to take that next small step toward better health, please give it a thumbs up, share it with someone you love, and subscribe to Elderly Health Tips for more real, research-based ways to live stronger, longer, and more freely.